Welcome again to the School of Public Health Research Network webinar on the commercial determinants of health. I'm Dr. Marco Bardos, I'm an assistant professor in public health, and I'm chairing this webinar today. Our guest speaker is Dr. Nason Maani, who is a senior lecturer in inequalities and global health policy at the University of Edinburgh Global Health Policy Unit in the School of Social and Political Science. He serves as a deputy director of the Local Health Global Profits Research Team in the UKRI Population Health Improvement Network. Dr. Maani's research focuses on the commercial determinants of health, seeking to describe the mechanisms through which commercial actors affect health inequalities, knowledge, and public discourse. He was the lead editor of the Oxford University Press textbook, The Commercial Determinants of Health, and is the author of the upcoming book, A Healthy Profit, which is going to be published in 2026 by the OUP. He's a Commonwealth Fund Senior Harkness Fellow and a Fellow of the UK Royal Society of the Arts. He hosts Money Power Health, a podcast series discussing the social and commercial forces that shape health, and is an essayist of Substack and contributor to public-facing outlets such as the BMJ Opinion, Psychology Today, and Scientific American. So without much further ado, I invite Dr. Nason Maani to talk about the commercial determinants of health information. The floor is yours. You have about 30 minutes to present your speech, and then we have a session for Q&A. Thank you.
Thank you so much, Marco. Hopefully you can hear me okay. Yeah, okay. So apologies to everyone that I have this podcast microphone, but my computer microphone wasn't working, so you get the full kind of smoky DJ experience. So it's a real pleasure to be part of this series, and I really enjoyed, I have to say, the previous webinar by Professor Boyland, which this hopefully complements, I think, quite well. So I want to talk about the commercial determinants of health information, and I think it's important to start by reminding ourselves that even though perhaps within public health we understand the extent to which sort of forces beyond individual choice, behavior, knowledge matter dramatically when it comes to health outcomes, there is still, I think, an undue focus on the kind of importance of health literacy, the provision of accurate health information, and certainly that's a lot of what we do in public health and what we think about. And it reminds me a little bit of this story by Sandro Galea, who's a kind of dear collaborator of mine going back several years, from his book Well. And he talks about a pet goldfish that he cares a great deal about. And because he cares so much about his goldfish, he's constantly telling the goldfish how much exercise to do and how much goldfish food to eat, and like how many little goldfish push-ups to do and all this kind of thing. And the goldfish is lapping it up. The goldfish is super keen to be as healthy as possible, so it is doing its laps. It's getting up at 5:30 every morning. It's posting on LinkedIn about all the wonderful things it's doing. But within a few weeks, the goldfish dies, and Sandro's very sad about this. And the reason the goldfish died is because he forgot to change the water. And he uses this as kind of a kind of story as a way to describe that. While health promotion and the provision of health information is clearly important for health and for making healthier choices, those choices occur in the context of like these wider environments. And we shouldn't lose sight of that fact, not just physical environments, but also social environments and indeed informational environments. And, so we all know this, right? Like this is kind of old hat at this point, that these forces dramatically shape our health. But it's over the last, I'd say, 10 to 20 years that there's an increasing understanding that these kind of wider environments that shape our health, the social determinants of health, are in turn not just shaped by sort of government or by community action, but are also shaped by elements of the private sector, not just when it comes to things like like lost productivity or harm to self or the societal cost imposed by things like tobacco or alcohol, but in all through the kind of rainbow in terms of climate change, deregulation, the kind of the shaping of social norms through marketing, lobbying, political funding, tax avoidance. Like these are just some examples of the ways in which population health is really profoundly shaped by aspects of the private sector through its impact on these wider forces. And when we think about some of the main public health challenges we face currently, globally, but also in the UK, the aspects of the commercial sector really loom large in terms of how they've shaped the environments that we're navigating, either the physical environments we're navigating or the social environments we're navigating. And so, this is just to borrow one of the examples that Professor Boyland used in her talk, right, to think about the rise, the kind of consolidation in terms of the relatively few companies who produce a great deal of ultra-processed food globally, and then just the rise in the transition to more ultra-processed food consumption around the world. And you can see this happening in every single region of the world. And I guess the obvious point to make is that this is not happening because of a lack of health information. You know, this sort of inexorable rise across all these regions in UPF consumption is not because suddenly there's less health information than there was before, people are less motivated to improve their health than they were before, or that a particular forms of health information will reverse this trend, right? It's clearly to a large degree due to much bigger forces, social determinants of health and commercial determinants of health, the ways in which the private sector is shaping demand and supply. And that is not just true at the country level, but it's also true in the local level, right? And in part, commercial determinants of health are useful in thinking through some of the structural drivers of health inequalities, like sort of what are the modes of action. So this example just shows the clustering of unhealthy product outlets and how it increases linearly with deprivation in Glasgow. So you can see this for alcohol outlets, tobacco, takeaways, and gambling outlets. And you see similar patterns when you look at exposure to outdoor advertising, where sort of a majority of outdoor advertising is in the poorest 50%, in the poorest 50% of regions or deprivation. So you have this kind of overexposure and overclustering of these kind of unhealthy elements of the environment in poorer areas of the country. In other words, the water in some areas is just simply not as clear, to go back to the goldfish metaphor. And the flip side is that when it comes to certain companies, there is an over-reliance on the heaviest consumers. So this is an example of a thematic analysis of internal advertising case studies that we did. So these weren't intended to be publicly viewed. These were internal alcohol industry case studies, and that's why the language is perhaps a bit coarse. So apologies for that. So when you look internally, what they say, this is an example from a whiskey advertising case study. As is the case in many post-mature markets, which the UK is, whiskey brands are very reliant on a small number of heavy and increasingly aging consumers to provide the majority of volume. Our first advertising task was to protect and build this core drinker base by persuading existing customers and drinkers of competitive blends to choose the famous grouse more often. In the longer term, we had to attract more younger drinkers, the heavy-using loyalists of tomorrow. In another percent of drinkers account for 80% of sales. So rather than struggle to make whiskey appeal to younger consumers like premium brands, we chose to focus on the core audience of heavy users. We knew they were older, we knew they were male, we knew that unlike malt users, they tended to be down market. So what you can see here is almost like a flip of the asymmetry that we're often really careful about when we're thinking about health promotion or health information, right? Where we acknowledge that if we're communicating to the population, typically there is a risk that we exacerbate health inequalities because the people who are most likely to act on health information already enjoy certain advantages in terms of agency, in terms of level of income, right? In terms of autonomy in their work and private lives, where they're able to make these kind of changes, and they have a degree of health literacy already, sort of like what you might call the worried well, are more likely to respond to health information messaging. The flip side, however, which is I think much less well understood, is that there's another aspect to this asymmetry, which is the fact that in some cases, it's the most harmed who are disproportionately, in essence, targeted in terms of targeted marketing for the overconsumption of unhealthy products. So you have this kind of weird two-way inequality. And that isn't just in relation to, I guess, kind of specific focused targeting messages, right? Or availability differences, but it's also around broader language around whose choice and whose responsibility it is for population harms when they arise. And we see this in the context of fossil fuel companies, and Nomi Oreskes and Jeffrey Supran have done some amazing studies looking at how fossil fuel companies frame climate change drivers and solutions. And a lot of the drivers they frame around complexity, demand, individual responsibility. You know, it's about carbon footprints, or it's about people individualizing, like how they respond to the climate crisis and being more kind of conscious consumers. You may have seen like recently there's like an SO campaign for like more careful driving to reduce your sort of carbon footprint that way. We see this in the context of sugar sweetened beverages, right? Like this notion that it's about exercise, it's about individual responsibility. Obviously, with alcohol, you see this all the time with regards to sort of responsible drinking campaigns, sort of again emphasizing that it's really about individuals. And so any harms are due to individual responsibility rather than anything the company might be doing. And we see this in our research in the US on firearms. So again, in the wake of mass shootings, the manufacturers of firearms involved in mass shootings will say, you know, lately we've witnessed an erosion of personal responsibility. It's not about us manufacturing firearms or increasing firearm availability. It's just about some kind of notion of personal responsibility and that eroding. So just to think a little bit about then the commercial determinants of health information, I think one area that I've done a bit of research on with some colleagues is around alcohol. So I thought it'd be useful to kind of take this as a kind of an example of how information seek to shape the information environment from the individual to sort of what the view of policymakers and the kind of population writ large is. So the first thing to say when it comes to alcohol is that there has been a real spike in harms in recent years in the wake of the pandemic, driven by a polarization in drinking trends. So those who drank less before the pandemic started drinking even less, and those who drank more before the pandemic started drinking more. And like, so in some ways, this is kind of a public health crisis. And from the perspective of government, it's occurring in exactly the age group that the government is very focused on for other reasons. So in kind of working age adults. But if you look at the kind of fact sheets and sort of public facing communications of the alcohol industry through the Portman Group, which is like the main alcohol industry self-regulatory body in the UK, they kind of are saying the opposite story, right? They're saying that we've had over a decade of falls in alcohol harm, for example, in Northern Ireland. And they're cherry picking things like a fall in underage drinking, or emphasizing that most adults are drinking within the low risk guidelines. I mean, that obviously also means that the vast majority of the Portman Group's sales are coming from those who aren't, but that's flipped around in this. The same is true, in their fact sheet about Wales. They talk about kind of focusing on these kind of positive trends and actually saying these are a result of our activities of the industry, that these positive trends are because the industry is doing this, without actually mentioning the kind of the overarching really negative trend in terms of alcohol specific deaths. So that's kind of framing whether we think of alcohol harm as a crisis or not, and to what degree it's it's moving in a positive or negative direction. But when it comes to what we think about specific alcohol harms, there's quite a lot of research now on how the industry funds health information organizations to produce information for the public that differs materially from that of independent alcohol charities. So previous research has shown that this can include misinformation on key alcohol harms that might otherwise really affect alcohol consumption, things like cancer, for example, particularly around breast cancer. The materials tend to emphasize, again, personal responsibility and no reference to best buys or to WHO recommendations. And they include dark nudges and sludge. So dark nudges being kind of subliminal messaging, where there's sort of like a glistening pint of lager, even though the message is about drinking responsibly. And sludge being this idea that there's lots of superfluous information that you've got to get through to some of the main harms. So like you have to sort of swipe through pages of, does alcohol make you pee more? Does it give you a beer belly? In order for you to get to, alcohol can harm your unborn baby. And Mae van Chalvik has led on some really good research that's looked at similar kind of organizations and their work in schools, and showing that the alcohol industry funded education programs in schools, again, tend to sort of overemphasize the positives of drinking, frame it as something very normal for children to do when they're older, when they're adults, and focus on kind of causes of harm that are not the industry. So are focused on the dangers of peer pressure or, you know, that kind of thing, but don't mention things like alcohol advertising or marketing. And you may have come across the kind of Drink Free Days campaign. This was a few years ago now, and it was a partnership between PHE and one of these industry-funded charities called DrinkAware. And it consisted of a kind of national campaign to sort of take more drink-free days. And it was criticized at the time by charities and public health stakeholders. And evaluations have examined the ways in which it was perceived by different stakeholders. And we did a FOIA, an analysis of freedom of information requests, that showed that behind the scenes, as Public Health England realised there were problems with the DrinkAware website, that some of the concerns being voiced were kind of legitimate, there was this kind of effort, both by industry to exclude dissenting voices, sort of framing them as ivory tower, framing sort of certain civil society actors as anti-alcohol, but also to kind of manage their reputation and to resist independent scrutiny of things like the website. And huge thanks to Private Eye for covering some of this in their reporting. So that was just to think about the different ways in which health information around alcohol can be contested by commercial interests, by like the commercial drivers of information around alcohol, from whether or not it's a crisis to what specific risks are involved with alcohol consumption, and to what the nature of campaigns is around alcohol consumption, what their focus should be, who's a legitimate partner in seeking to communicate to the public on alcohol consumption. So even something as simple as a health promotion campaign, where you might think, look, if the industry is willing to fund a health promotion campaign or a charity that does health promotion, great, funds are limited, this is fantastic. But actually, when you think about the system level effects of these kind of things, they kind of add up to quite significant potential harm. So if we participate in these kind of initiatives or even just allow them, then that can health wash marketing messages, right? By having like the little logo that says, for the facts, go to XYZ. It can expand the presence of the industry to environments where it wouldn't normally be able to go, like schools. It can lead to sort of normalization of alcohol use from a very, very young age. Obviously, these websites then become a safe space for the industry to direct consumers to, because they're places where maybe the key harms the industry is worried about the public knowing are downplayed, but in parallel, there's no mention of policy best buys. Whereas if they were to go to an independent charity website, there would be mention of upcoming legislation, of the reason for like the benefits of population health measures to reduce alcohol harm. Beyond that, this kind of approach allows industry to claim health promotion expertise, right? And it helps reproduce that individual responsibility narrative. They can say, look, this is about better choices. We're helping people make better choices, and sort of have this kind of policy substitution effect, right? Like rather than focus on something like MUP, here's something that we will not resist you on. And ultimately that can legitimize the alcohol industry as a partner and part of the solution, and help perpetuate like it's the narrow definitions of harm that it chooses to sort of focus on, and create funding dependency, where if it's a case of now, okay, we realize this partnership is inappropriate, we need to withdraw it, we need to stop it, then that means there's now a vacuum. There's like a gap where funding needs to move in to fill or replace that initiative with. And that is not unique. That kind of dynamic plays out beyond alcohol as well. So we see similar efforts to cast doubt on the evidence of harm, of course, in relation to British American tobacco, but we see this in relation to sort of obesity and the role of foods that are high in fat, salt, and sugar. This notion that it's all too complicated. Again, with global warming, we see very similar efforts to cast doubt on the evidence of harm. So alcohol is just one, but very similar dynamics are playing out across these sectors, where there's an understanding that sort of a very well-informed public may choose those products less often, and that would be kind of catastrophic for revenue. So it's kind of sort of seeking to sort of overcomplicate messaging. And so we've tried to test some of these messages to see like the ways in which they resonate with the public. Do they affect public's perceptions of the links between products and harms? So we did an RCT where we exposed people to either one of these industry-funded messages on the links between products and harms, or to like a factual alternative. And what we found is that so we did this for alcohol and breast cancer, fossil fuels and climate change, alcohol and pregnancy, sugar drinks and obesity, and smoking and lung cancer. And what you can see is that overall there was a significant effect, and basically it was driven by increases in uncertainty. So the kind of industry messaging around products and harms significantly increased uncertainty in the mind of the public about the link between the products and the harms. And that was even true for smoking and lung cancer, where you would think the public would be very, very aware of that link. But this kind of alternative causation argument can be really powerful in shaping public perceptions. So we also see efforts by other industries like food companies to influence public consultations on prevention. Again, when you look at analyses of their submissions to WHO consultations, containing lots of parallels, that self-regulation is preferable, that this is about that regulation is too simplistic, that and these are really it's about individual responsibility, and there are really strong parallels between the submissions of all these companies and their trade groups and other organizations. And just to highlight an example of the ways in which this can be even more direct, like the efforts to influence public consultations and policy can be even more direct. This is an excerpt from the public consultation report from the Tobacco and Vapes Bill. And this is a consultation that was open at the end of 2023. And in the government's own report, they say that they received about 120,000 responses to the consultation, but of those, over 90,000 were identified as being submitted by bots, by automated programs, and so deemed fraudulent. And I think that's really remarkable, isn't it? Like that we would have a public consultation on something as important as kind of vaping policy, and that over 3/4 of all the responses received that public consultation were fake. I mean, fake responses to consultations don't grow on trees. Like that's a coordinated effort. And so I did a freedom of information request to see what those bot responses were actually, what were they saying, what were they submitting? And I've gotten very little information about it, but what I did find is that of those 90,835 bot responses, 90,833 of them disagreed that restrictions on disposable vapes should take the form of prohibiting their sale and supply. So make of that what you will. So we talk about these kind of things as being an example of the pollution of discourse, right? So going back to the beginning, the idea that like physical environments, the goldfish bowl can be polluted, but so too can discourse, right? Like with an undue emphasis on individual responsibility, on kind of downstream solutions versus upstream ones, on self-regulation or deregulation, and just disputing public health evidence and prevention more broadly. And I think if I've got time, I just want to briefly talk about kind of what is the not so new frontier, but basically what to do about health literacy and risk communication and health information amidst algorithmic driven targeting. Because I think this is kind of a new, but really, really problematic phenomenon where when people are seeking health information, the act of seeking health information means they are targeted with health mis and disinformation. So we've done several papers that have looked at what happens when you look for health-related search terms, and particularly we looked at cancer-related search terms. So say if you wanted to Google terminal cancer treatment or chemotherapy side effects and how to manage them, that kind of thing. And this work was led by Marco Zanoni, who's a colleague and current researcher based at the University of Alberta. And what we found was that the sponsored hits at the top of Google searches were for alternative cancer treatment clinics, were for sort of essentially alternative or pseudoscientific treatments for cancer. So these clinics were paying to appear at the top of searches for things like terminal cancer treatment. And as we wrote in this paper, this meant that Google was essentially allowing these clinics, these advertisers, to target sensitive informational queries of cancer patients, people who are in a very who are in a vulnerable state and are looking for accurate health information. We did a separate study that looked at the same kind of terms, but on Amazon. And what we found is that the majority of hits on the first page of Amazon books, when you look up something like cancer cure, again, are these kind of pseudo-scientific approaches like curing cancer with carrots, or the liver cure, or like suppressed cancer cures that the government or that the industry won't tell you about. And so you can imagine someone who maybe does a Google search for cancer treatment, comes to, so that it finds these kind of spurious targeted sponsored hits, then goes to Amazon and tries to look up a book to see if there's some credence to this. And, you know, a big part of the first page is with this kind of thing. And we looked at this on Meta as well, because these clinics can also target people on Meta. So if you do something that marks you as having cancer, for example, join a cancer support group or something like that, you can then be targeted by these clinics with these kind of adverts, patient testimonials saying, you know, have you been told all hope is lost, and this kind of thing. So again, you have this perverse dynamic where even the searching, the act of seeking accurate health information can mean that you're targeted by commercial operators and alternative cancer treatment operators, mediated through algorithms, you know, through like Google or Meta's algorithmic targeting, to kind of target you with these kind of mis or disinformation campaigns, ultimately with the goal of parting you from money. And some of these treatments are incredibly expensive. You know, they're unevidenced, unproven. You know, they could be crystal healing, faith healing, all different kinds of things, but they could be thousands of pounds a week. So I think just to conclude, the value, I think, of research on commercially driven health information is threefold. First, I think just doing research on this kind of thing is a form of counter-marketing, you know, and centering companies, brands, and sectors as units of measurement rather than products or consumption patterns, I think is in of itself useful in terms of placing the emphasis on areas that require more regulation, more control. This kind of research is also a way to expose power imbalances, right? Because rather than just telling the goldfish how to stay healthy, you're also exposing what is muddying the water in the first place. And this can also help in terms of elucidating mechanisms, like why it is that health inequalities remain entrenched in relation to certain health behaviors or certain consumption patterns, or why we see policy intransigence, or why we see a lack of trust in public health evidence or public health actors. Clearly, this is not the whole picture in any of these issues, but hopefully doing research on commercially driven health information can help us understand some of these issues more. And it does seem to be data that the public really cares about. You know, it's definitely data that sort of resonates in the sense that, and so speaking to public panels, and colleagues of mine in the Spectrum Consortium have done work with citizens' juries, you know, members of the public really get the kind of power asymmetry here, and they get the kind of sense of fairness, of wrongness, the idea that there's this information asymmetry that goes with it, and there's this kind of perverse incentives to like misinform the public or to shape policies in ways that advance profit rather than kind of pro-social goals. It's also data that civil society can act on. So there's been, the work that Mae van Schalvik led on, for example, led to a campaign to ban school materials that were funded by food, drink, and gambling firms because of this risk of bias and this risk of shifting social norms about what children perceive as good or acceptable or desirable at a very young age when it comes to, say, ultra-processed foods or when it comes to alcohol consumption. We've also seen like civil society in Ireland through the Alcohol Forum developing IMARC, which is like a mark of independence from the alcohol industry for civil society actors to put on their website. So if they don't receive industry funding, it's kind of like a mark of independence that they can hold up as a kind of to show that they are free from bias. And in doing so, it's also a form of counter-marketing, right? Of like the fact that otherwise there is this risk of debates, public understanding being distorted by commercially funded organizations. And in Scotland, you know, the NCD Alliance, the Scottish NCD Alliance produced a kind of manifesto, a 10-year manifesto on NCD prevention based around the notion of a commercial determinants of health approach, and acknowledging that it's not just about changing patterns of consumption, but it's about changing the ways in which government makes decisions so that conflicts of interest are better understood and managed. And things like conflicts of interest management and public health practice and tools are evolving in line with this. And there's been a really exciting explosion, often led actually by UK practitioners in terms of the Association of Directors of Public Health, the Good Governance Toolkit, the Faculty of Public Health, local directors of public health, kind of producing reports and tools for how to better manage conflicts of interest, how to kind of onboard newly elected councillors around these issues, and are sort of, I think, really, really exciting ways of sort of trying to counter some of this power asymmetry and improve population health in a kind of more equitable way. And it's not to say that this is about being anti-private sector in general, but it's just to say that when we're thinking about the commercial determinants of health information, and we're thinking about these environments, what to do about them, it's a case of following the data to the right pump handle wherever it leads. And rather than sort of thinking, gosh, we're in an environment that's just suffused with health misinformation, let me sprinkle some accurate information into that, is to say, no, I need to actually think about what is driving this, what are the pump handles that are producing this, and remove them. So in conclusion, I think commercial determinants of health offers a way of examining why, how, and what to do about business practices that affect health more generally, and I think there are ways in which that applies to what we care about. And improving health information is not just about better health promotion, but also reducing the pollution of discourse and of the information environment. And that, I think, can be impactful and a complement to the things that we're already doing. So, sorry, that was a bit of a whistle-stop tour. I'll stop there. Thank all the colleagues who've been involved in this. Some of this is in an upcoming annual review of public health article on commercial disinformation. So thanks to my colleagues who are co-authors in that, to my funders. Thank you, Marco, for mentioning the podcast and Substack. Here are some QR codes if people are interested in following the conversation there. Thank you.
Well, thank you, Nason, for this. I would leave the slides there so that people maybe can take a snapshot or visit the Substack and podcast. Are there any questions from the audience first? If someone has any question, maybe you can raise your hand, open your mic, and speak up. We invite you to do so. Of course, if you're in the condition.
Fine. I'll try anything. If you want to go down the Elon Musk route, that's totally fine with me.
So if anybody wants, Amelia.
Hi, apologies. I'm in a noisy corridor. Nason, thank you. Fabulous presentation. I was actually I've been thinking about teaching today, and just thinking about, our new generations of either allied health professionals, public health teams. How do we blend this into our teaching? Because especially when we're talking about nutrition, this is so important. So I suppose useful tips on how we build this into capacity building with our masters, our postgrads, and also our undergrad students.
Yeah, thanks so much, Amelia. It's great to see your face, even in a busy, noisy place. That's a really good question. And again, I think there are some colleagues doing amazing work on this. So we had a chapter in the Commercial Determinants book on teaching on this issue. And so they pulled together resources, courses that are already underway. That's part of the reason for the podcast, which is kind of part of, it's free to use, and sort of the MPH program in Stirling, for example, it's like just part of their recommended reading is they can just listen to an episode on this, that, or the other. I think though, what you're sort of, to go a bit deeper into your question, I think the big challenge is to what degree we turn this into like core competency that sort of has to be shared by public health practitioners in nutrition, in medicine actually as well. I think that's a much bigger question. What's really exciting is when you see things like Faculty of Public Health kind of taking a real interest in this, or you see medical schools adding this kind of topic to the reading list and to the top material. I think that's really promising. But the more that we can get people like yourself, prominent voices in the field, to sort of say, look, if you want to teach on this subject, this is one of those things you need to engage with, the better. And what I would say is that if you are a teacher, like, students really like talking about this kind of stuff. This is quite often a topic of dissertations, of seminar groups, And one of the great ways that the great things you can do with teaching it is you can just give them the raw data. You can give them consultation responses. You can give them a corporate social responsibility campaign and let them dissect it themselves. And that is really, really fascinating quite often.
Excellent. I think this is a perfect segue for Chloe. Chloe Rogers is a current MPH student in Birmingham, right?
Yep, that's me. Hi, Nason. Nice to see you again.
Hey, good to see you too.
I was just going to ask a question about like boycott, diversity, sanctions. Obviously, now we're in a situation where globally there's a huge movement towards divesting from partners that have specific investments in, like apartheid states and war machinery and that kind of thing. Where do you see the role of public health either now or maybe where it needs to go in order that that can become something that is recognized as like a driver for something that public health professionals can be at the forefront of?
I mean, fantastic question. I think your finger is already on the pulse of where some of these things are going. So I'm not sure if you saw, but this past month there was a special issue in the BMJ on the arms industry as a commercial determinant of health, and I wrote an editorial with a colleague on kind of where public health research can go in this area. And we touched on sort of issues like divestment and the importance of divestment when it comes to kind of armed conflict and the role of medicine in kind of being such a prominent and trusted voice in the mind of the public that in a way us lending our voices to those kind of divestment campaigns is incredibly powerful for that reason. So I think you're absolutely right, and it's really even just the process of trying to get stuff published in this space has been a really interesting learning experience for me personally, in the sense that just we've had other papers in the past that have been rejected on the grounds that it's like too political to sort of talk about, even to talk about the arms industry. That's like, whoa, that's too political or that's too biased, and where it's sort of anti. Yeah, you know what I mean? Like, I don't think it's straightforward, but I think we can learn a lot from other movements that have sought to do similar things. And I thought it's been really interesting to see the US public health community, which is obviously dealing with really difficult challenges right now with the current government and that kind of thing. But it's been really interesting to see sort of leading articles. You look at Nancy Krieger publishing a series of articles with colleagues, Sandro Galea as well, on things like reparations as a public health investment, as a public health intervention, right? Or like bringing together evidence, like sort of bringing together epi-evidence on structural racism, and sort of like recentering these issues on the empiric and reframing them. No, it's not that this is political. This is an evidence-based, evidence-informed approach, if that makes sense. And sort of I think putting things like divestment in that same bucket. Look, this is not a party political thing. This is actually an evidence-based intervention to reduce population, to reduce harm in the longer term. This is like I think that those can be really, really impactful, and that's where we can really add a lot, potentially. I hope that was okay, Chloe.
Yeah, it was great. Thank you.
Thank you for the intervention also. I have a comment here from the chat. I was teaching from Jack Birch. I was teaching third year undergraduate nutrition and dietetic students about this, I think, the social determinants of health yesterday, and a couple of them mentioned about the negative impacts of profit-making organizations on the food environment, which I was really pleased to hear. I pointed them towards your work, Nason. So this is like a comment. You have a fan.
That's great.
One of the fans, yeah. I think then as a comment from Amelia, thank you for being here, for showing, for taking time to be with us today. And she also added public health is political, and I agree to some extent to this, because part of our role, I think, is to be advocates for
100%.
those who cannot advocate for their own health. And agree with that. There's a comment or question from Theokaris. Following up on the teaching question, there is also a tendency for university to move towards integrating employability in their curriculum and work very close with the industry. Do you think this is conflicting with increasing students' awareness on commercial determinants of health? Sorry, but I cannot really ask through the mic as I'm in an open space area. Thank you for typing.
Great question, Theo. Patty, I think that's a really complicated question, and it was actually the subject of a recent podcast episode with Nora Campbell, who is at the Trinity Business School. So she's obviously teaching, students come there because they want to learn business competencies, and she's teaching them about commercial drivers of harms and stuff like this. And it's a challenge because part of this is a contract that we have with students, right? Like that some students come to us because they want to gain certain competencies, because they want to go out into the workforce, right? And that is a pretty weighty responsibility, particularly at a time when graduate employment is incredibly difficult. But we have to balance that actually with kind of the core function of academia, right? Which is actually to prepare them for a life of critical thought, and the fact that very few academic degrees now are vocational and lead to one job for the rest of your life. So in a way, we have to teach them to be able to have their finger on the pulse of difficult issues, to see the underlying causes, longer term patterns. And I think this is an example of like moving upstream. This is like just a real world example of public health moving upstream and trying to take the public and decision makers with it upstream. So yeah, I think we can do, hopefully we can do a little bit of both. And I'm just really struck by the example of, I remember watching this quite old talk by Ralph Nader, who was like an environmental activist in the US, to the Harvard Law School, where he was an alumni. And he made a really interesting point, which was, probably most of you who are graduating from Harvard Law think that you're now in a position, I've graduated from Harvard Law. Like no one's in a better position than me to change the world, to advocate for the marginalized, because I've just graduated from Harvard Law. And he said, but statistically, like the majority of you will spend your lives defending the status quo to put your kids through college so that they too can go to Harvard Law. Do you know what I mean? And that is, that's not what we want for students. That's not what I want for my own children, right? So we have to, I think, be a bit more aspirational in what our goal and definition is of success in education.
Thank you. Are there other questions, comments, compliments?
We don't need compliments.
I don't think you need compliments.
No,
I have a question. I mean, I have several, but I think I will go with
Hit
one.
me, Marco.
You mentioned at the beginning the role of health literacy, and I was thinking, what could we do also to somehow inoculate people against this commercial determinants of health, maybe enhancing critical media literacy or something like that. What do you think about that?
So I think there's definitely, there is a bit of a literature on pre-bunking, like this idea of priming people to miss or disinformation. So I think that's definitely, there is a literature around that. There's also literature around counter marketing. So social marketing that focuses on like the drivers of illness rather than the products. So like a really prominent example would be in tobacco, one of the most famous ones was, the Marlboro Cowboy. There was like a counter marketing poster, which was him next to his, him next to his dead horse. And it says like secondhand smoking kills, and so like that kind of thing. But I think also maybe it's also widening what we think of as public health interventions. So when I think of health literacy, for example, expanding that to sort of broader civic literacy, to like understanding and building capacity to do things like participate in local consultations and elections, to get involved in things like alcohol advertising or outlet advertising. Like these are in theory areas where the public is allowed to come along and offer their, offer evidence, thoughts, perspectives. And we know in public health, those can be quite powerful those can be quite powerful interventions. Letter writing to MPs is very, that can be very powerful, but it's often not couched in terms of a public health intervention per se. Um, so I think that kind of thing can be really, really helpful. Greg Fell, who I'm sure many of you may know, he talks about funding kind of the Citizens Advice Bureau in Sheffield as a public health intervention, because it is a form of health literacy, like teaching, helping kind of that population have a better understanding of the range of benefits and services available to them is in itself a form of health literacy.
Thank you. We have another question, Amelia.
Sorry, I will be quiet. Nathan, just there when you were talking, and you were talking about your kids, and I was thinking about my kids and how they often at breakfast are having a commercial determinants of health lecture before they go to school. And I'm quite aware that young people, we know from our research, I know from our research around energy drinks, that they're pretty savvy about the marketing techniques, but they all still fall for it. How do we, you talked about alcohol industry being in schools, doing that education, funding that education. It's made me think I'm going to write a letter to my kids' school. But also, how do we, from an early age, what tools are there around giving to schools that they can use for education? Because this broader health literacy, especially in a saturation of misinformation. We need to start young, basically, don't we? And I don't know what the evidence base is around that.
So it's still, I have to say, I'm not an expert myself. I have seen examples of, for example, youth-led counter marketing around vaping. So there were some colleagues in Stirling that led on development of videos that were sort of led by youth describing like vape marketing in their local area and their views of it and that kind of thing in a very accessible way. There's actually, I know a PhD student currently working on at the University of Bath as part of the Local Health Global Profits consortium on doing a piece of research on industry information in schools in general and sort of possible kind of policy ways to address that. But I think more deeply, certainly for my own kids, so Charlie is actually on the podcast. He's 12 years old and he reads the outro, if you enjoyed this podcast, please consider, that kind of thing. And actually, I think the best thing to do is learning through doing. I actually think that kids have a better sense of a lot of these things than we do. And part of what we want to teach them is not so much about commercial determinants of health, about X or Y, but we want to teach them and model, what you can do with education and competencies. Like, we want to say, yeah, you can do things you believe in. You can go and bear witness to really powerful forces that shape the world. You can do things that are meaningful. And I think that's what we should be encouraging them to do, like to be part of that from an early age, to be part of like campaigns in schools and wider, to do those things. Not just because we want to address the commercial determinants of health, but ultimately because, that's a more fruitful, that's a more enjoyable life, to do things that you believe in with people you trust. So the sooner we let them do that, I think the better for them and the better for us.
Excellent. Thank you. I have another question. I think we have like 9 more minutes. I think we can go with
sorry,
it.
did I go too fast through my presentation, Mark?
No. It was perfect on time. I didn't have to stop you for them. No, it was great. Gambling. Is there anything we can say about gambling in the UK context?
Yes. Oh, there's a huge amount. I should say
I know,
that.
and it's a lot of money that the government is, through NHR and UKRI are putting and investing in gambling and commercial determinants of health.
So I think gambling is a real cautionary tale. Like gambling in the UK is a cautionary tale in multiple dimensions that I think we really should learn from. So going back, and the work of Rebecca Cassidy, who's a fantastic anthropologist based at Goldsmith, is really, really instrumental and is inspirational to me, both because she did really difficult work. Do you know what I mean? Like in a male-dominated space as a woman, she did very difficult, very critical research. So I really recommend looking into her work. And she was a guest on the podcast and talked really candidly about some of these challenges. But basically, she showed that over the last 20, 30 years, because almost all gambling research was industry funded, it led to this really distorted policy landscape of very narrow options, of very distorted definitions of problem gambling, of a gambling research that was in essence dominated by psychiatry and addiction, genetics, and like trying to, it was kind of dominated by individual level reasons for gambling. Does that make sense? What makes a problem gambler? That was the dominant question of gambling research. And I think it's a real cautionary tale, because it just shows if we get to extremes, that's where that takes us. Industry funded research will never tell us the whole picture because of that. I think the problem that we are now is that we had a huge liberalization of gambling, right? That created a burgeoning industry, a lot of money that then has power and momentum with it, right? And then the government's thinking, okay, we need a slice of this, or we need to somehow pay for treatment for like for kind of public health research. But the gambling landscape remains, like the people who've done gambling research over time, remains dominated by those kind of lenses and those kind of questions, because that's just the nature of it, right? So it's like trying to turn a really big ship around. And the final part of this cautionary tale, I would say, is it happened here first in the UK, but then a very similar process played out in the US. So in a way, and this applies in alcohol as well. Like the UK, England in particular, has a very permissive self-regulatory approach to alcohol marketing, for example. It isn't just that we choose it for ourselves. We become a blueprint that the industry exports to other countries and says, you can do it this way, And so, unfortunately, we bear part of the responsibility for the explosion of sports betting and sports betting related harm in the US, on a totally different scale. So I think that's those are the reasons why I think gambling is a cautionary tale here. And yeah, I wish I could say, sorry, I've probably ranted enough, Marco, but yes.
No, it is. It's very important. I think I have one last question, not from me, but from the audience, from Jo Django, is a doctoral fellow, research fellow with Birmingham here. So she's sharing that her doctoral research focused on influencers and health communication, health promotion. So she found your talk from commercial perspective really interesting. One small question, which is, I don't think it's small, but with the growing prevalence of algorithm-driven misinformation and rapid advancement of AI for content creation and information seeking, are there any emerging research areas or topics that you personally find especially exciting or think are particularly important for the field to explore going forward?
Definitely. I think so. Exciting is probably the wrong word. I mean, I think we're all in a period where we're probably tired and worried and drained about it rather than excited. But as a doctoral student, I think you're in an incredibly dynamic, exciting area. Like, this is a really cool area to be in. And I think one area of focus that we need to focus on a lot more is individual journeys within this digital ecosystem, because they're so varied. The opportunity for health inequalities is so magnified. I just gave the example of a cancer patient, right? For any of us who hasn't Googled terminal cancer treatment, we will never see those adverts. If we never join the patient support group, we will never see targeted meta ads to that effect. It's incredibly personalized, and there's something very lonely, about the fact that your personal digital exposome is so personalized. Does that make sense? And so I think that's something we really need to think about a lot more carefully and understand a lot more. I think that'll be a big focus of research. I think the other is around policy and regulation and what we can actually do about these kind of things. Because at the moment, particularly with the advance of AI, there is a concept known as Google Zero. Have you heard of this? So I presented some research here on Google searches, but in the industry, particularly within the advent of AI, there's this notion that we'll reach a point of Google zero, which is the point at which essentially no one
Will Google
finds
things.
finds any kind of information
And
through Google.
yeah,
Instead, it'll be through an AI
true.
agent that
Yeah,
they'll
which is
say,
already Gemini is integrating that. So people
yeah,
do not Google, they just look at the first few sentences to get an idea without clicking, without delving into this information.
yeah,
Yeah.
and these agents are not being trained primarily with the goal of the benefit of mankind. Like they're primarily being trained with the goal of,
Probably
you know,
advertising also.
exactly. So that is incredibly important when we think about, understanding algorithmic bias then becomes incredibly important for a whole range of things, right? Not just health information, but like issues way beyond that.
So it sounds like we might have you back on
I don't know about that.
in a few
I don't know about that. Oh, no,
in the new year.
definitely.
Let's park it for 2026, January, February. We have to think about the next season, if you want, of webinar. So this might be one of the topics we can talk about.
Yeah,
And
it was a
I'm pretty
pleasure.
sure that will be very, very much followed. So I'll get back to you with that. Okay. So I think, yeah, we reached the conclusion of this webinar series, or this webinar, sorry, another series. Next week, it's going to be me talking about media relations for effective health communication. This is because it was requested by the network, so I'm responding to some requests there.
Awesome.
We have a lineup of speakers that are always interesting, and of course we open up also to the members of the network to propose ideas or to bring their own experience here. So I invite anyone who wants to join the network to do so by clicking on the link below or in the chat now, not in the link below. So thank you once again on behalf of the whole network for joining us. Nason will be in touch, I promise you. And thank you everybody for attending today. I'll see you hopefully next week and see you soon.
Thank you, Marco.
Thanks
so much for organizing. Bye, everybody.
My pleasure.